Now, we're moving on to the body systems. There are certain systems in the body. So we move on to the first system, that is the skeletal system. We have body systems, and first one being the skeletal system. So what is skeletal system? As the name suggests, skeleton. Skeleton is made up of bones. So we'll be discussing about bones in this system and joints respectively. A skeleton has two subgroups, that is axial and appendicular. So the human skeleton has two subgroups. We have axial and appendicular. The axial skeleton consists of cranium, sternum, ribs, and the vertebral column, whereas the appendicular skeleton consists of only bones of the upper and lower limbs. And this system mainly consists of bones and cartilage. So we move on further to what is a cartilage. Cartilage is actually an avascular form of connective tissue. When we say the term avascular, what it means is that it is deprived of any kinds of blood vessels. Avascular means no blood supply. So cartilage is an avascular form of connective tissue. That means there is no blood supply to the cartilage. A cartilage is made up of some extracellular fibers. So cartilage is an avascular form of connective tissue with extracellular fibers. Now these extracellular fibers are embedded in a liquid that we call as matrix. A cartilage is an avascular form of connective tissue with extracellular fibers embedded in the matrix. The type of cartilage determines the amount of extracellular fibers. You must have heard the word collagen fibers. What is a collagen fiber? Collagen fibers are structural proteins that are found in skin and other connective tissues in heavy weight bearing areas. The amount of collagen is highly increased, whereas areas where the stress is highly reduced, we have a large amount of elastic fibers. So what is the function of a cartilage? Cartilage provides support to the soft tissues of the body. It also provides a gliding surface for bone articulation at joints, so that joints can move freely, and it also helps in development of the long bones. There are three main types of cartilage that we can find in the human body. The hyaline cartilage. This cartilage is most common cartilage found in the body, and it has moderate amounts of collagen fibers and is found on the articular surfaces of the bones. Then we have elastic cartilage. Now in the matrix of the elastic cartilage, we have collagen fibers but with large number of elastic fibers. For example, our ears. Our ears have high amounts of elastic cartilage. Then we move on to fibrocartilage. Fibrocartilage have substantial amounts of collagen fibers, and they have limited number of cells. We can find fibrocartilage in our intervertebral discs, which are present between the vertebrae. So we have three types of cartilage, hyaline cartilage, which is the most common type of cartilage, and then we have elastic cartilage with large amount of elastic fibers in them, for example in the ears, and then we have fiber cartilage, which have substantial amount of collagen fibers and can be found in the intervertebral discs. So these were the three types of cartilage. And how do this cartilage get nourished? So the nourishment of the cartilage is through simple diffusion. Simple diffusion is the process by which a cartilage gets nourished. Move on further to bone. What is a bone? A bone is a calcified living connective tissue, and it forms the majority of the skeleton. What are the functions of a bone? Well, the bone, it supports the body. It helps protect our vital organs. They act as a container for blood producing cells. This is a bone, and this is the outer shell. So this is the outer shell, that is a compact bone. This is just a short introduction to the bones. We'll not be going into much details because that is a part of histology. So this is the compact bone, that is the outer shell, and then on the inside we have bone enclosing cavities. These cavities have blood forming cells, which is also known as the marrow. So the outer part, this is the compact bone, and the inside part, which are the bone enclosing cavity, which are filled up with blood producing cells, this is the spongy bone. We have compact bone and we have sponge bones. Compact bone, these bones are dense and they act as a shell. That is, they act as an outer covering for all the bones, and they surround all the spongy bones. All the spongy bones are surrounded by compact bones. We move on to spongy bones. Spongy bones, they have spicules of bone enclosing cavities. Now these cavities, they have blood forming cells. Spongy bones have spicules of bone enclosing cavities, and they have blood producing cells in them, which we also known as a marrow. So a marrow, a bone marrow, is a part of the spongy bone. Classification of bones. Bones can be classified on the basis of their shape. We have long bones, we have short bones, irregular bones, sesamoid bones, and flat bones. Long bones are tubular in shape, and the example of long bones are humerus. This bone right here is the humerus bone, and then the thigh bone, which is also called femur bone. Femur and humerus are examples of long bones. Then short bones. Short bones are cuboidal in shape, and the example for short bones are the bones in the wrist and ankle. The ankle joint and the wrist joint are example of short bones. Then irregular bones are of various shapes, and they're present in the face. Then we have sesamoid bones. Sesamoid bones, they develop between tendons. Example for sesamoid bones is patella. Patella, it develops between the tendon known as quadricep. And sesamoid bones are oval or circular in shape. Then we have flat bones. Two compact bones are separated by a spongy bone and are known as flat bones. The example for flat bones are bones of the skull. Bones of the cranium are an example of flat bones. This is a diagram of a bone. Now bones are vascular. Unlike the cartilage, bones are vascular, and each bone has its own nutrient artery. Each bone has its own nutrient artery. The nutrient artery, it enters the inner cavity of the bone and supplies the bone marrow. Bone marrow is supplied by the nutrient artery. It also supplies the inner compartment of compact bone. It also supplies the inner compartment of the compact bone. Now, every bone in the body is surrounded by a fibrous tissue. This fibrous tissue is called periosteum. Periosteum is the fibrous tissue that surrounds all the bones in the body. A bone without its periosteum will not survive. Absence of periosteum leads to death of the bone. Absence of periosteum, death of bone. Now the periosteum and the bone have common blood vessels. The periosteum and the bone have common blood vessels. They also have a common nerve. Now there is one place where the periosteum is absent, and that is the joints. Periosteum is absent at joints. And most nerves that enter the periosteum, they are vasomotor nerves. Now what do we mean by the term vasomotor? Vasomotor means that they help in dilation and contraction. So these nerves, they regulate the blood flow. These nerves, they regulate blood flow because they are vasomotor nerves. Now how is a bone formed? A bone is formed by mesenchyme. And what is mesenchyme? Mesenchyme is an embryonic tissue. This embryonic tissue gives rise to bones.